Receiving results from medical tests can sometimes feel a bit like solving a mystery, especially when the initial report is not completely clear. It is very common to feel a little worried when you get a mammogram result that is not a definitive clear or unclear. When your mammogram report shows a BI-RADS0 classification, it means the radiologist has found the assessment to be incomplete. This is not a diagnosis of cancer, but rather an indication that more imaging information is needed to make a complete evaluation and assign a final BI-RADS category. The reason for an incomplete assessment often comes down to needing a clearer picture. This could be because your breast tissue is dense, which can obscure potential findings on a standard mammogram, or because there is overlapping tissue that makes it difficult to see clearly. Sometimes, the radiologist might also need to compare your new images with previous mammograms, if available, to look for any changes over time. Occasionally, technical factors during the initial imaging can also contribute to an incomplete assessment, requiring additional views for clarification. The primary follow-up for a BI-RADS0 finding typically involves additional imaging. This often starts with more detailed mammogram views, known as spot compression or magnification views, which focus on a specific area of concern. You might also have an ultrasound of the breast, a non-invasive test that uses sound waves to create images and can distinguish between solid masses and fluid-filled cysts. In some cases, a breast MRI might be recommended, particularly if there is very dense breast tissue or other factors that make it difficult to assess the breast with mammography and ultrasound alone. These additional imaging tests are a standard part of the comprehensive breast imaging system, known as BI-RADS, which stands for Breast Imaging Reporting and Data System. This system helps standardize how radiologists interpret and report mammogram findings, ensuring clear communication with your doctor. The goal of these follow-up tests is to gather enough information to confidently reclassify your finding into a definitive BI-RADS category, providing you and your healthcare team with a clear path forward for your breast health. Ultimately, the follow-up for a BI-RADS0 result is a crucial step in ensuring thorough and accurate breast cancer screening. It provides the necessary clarity to either confirm that everything is normal or to identify any areas that need further investigation. By taking these next steps, you are actively participating in your preventative care, gaining peace of mind and supporting your long-term health.